Hello everyone. I am Dr. Sarada Mamilla, consultant obstetrician and gynecologist. So today we'll be talking about cancers in women. So everyone know about cancer. Cancer is an extra growth of abnormal growth of tissues, which can be life-threatening. So cancers can happen in men, can happen in women. Some cancers like lung cancer, brain cancer, skin cancers, they can happen in both men and women. But there are some cancers which happen only in women, like associated with the reproductive organs, uterine cancer, ovarian cancer, cervical cancer, or vulval vaginal cancers, breast cancers. So breast cancer can occur in both men and women. Today we'll be talking about all of these cancers in small bits and bits, small information about each of these cancers. So first, let's talk about breast cancer. So we all must have heard of these breast cancers. So who can get this breast cancer? So anyone, any women can get the breast cancer. What are the risk factors? So which can increase our risk of getting breast cancer? So if there's any family history, any genetic inheritance. So what does a family history mean? Family history means that one of our relatives, either mother or mother sisters or paternal side relatives, gets a breast cancer at a very early age. Early age is around 35 to 45. So somebody who is getting cancer at a later age, 70 years, 75 years, that is not a family history. So when we have a family history, the breast cancer comes very early, 35 to 45. So when a person has a genetic risk, there is a 55% chance of increased risk of getting a breast cancer, or being obese, very obese, or very early, starting their periods very early, or not feeding their baby can increase the risk of breast cancers. So how do we know that we have got a breast cancer? So all the societies, American Society, American College of Obstetrician and Gynecologists, the London College, or the Indian College of Obstetrician, we all have some set of recommendations. So they all say that we should get a screening test done. So what is a screening test? There's something called as self-examination of the breast. So each woman is supposed to check their own breast, palpate, check the breast for any lumps. So if you find any lump, any new lump, then you should once check with the doctor if it is a normal one or not. Most of the times it can be a normal lump. So normal lumps we don't have to worry. There might be a many normal lumps which are in the breast. But if it's a cancerous lump, then you are advised to get some more tests and take it forward from there. Or so self-examination of breast has to be done immediately after your periods when the breasts are not so painful. And you also should check for the position of the nipple. If the nipple is normal or if it is drawn inside, then we have to check for the nipple. And if it is drawn inside or if any secretions coming out, they are not a good sign. And you can also get an ultrasound of the breast. So there's something called as mammogram. So we all must have heard of this mammogram, and mammogram is there in most of the health checks. But the mammogram should be advised after the woman is at least 40 years. Only after 40 years, they recommend that we should do the pap smear test. And mammograms. We should do the mammogram. And every year, the mammogram has to be done. When the woman is after 55 years or at least 60 years, we can increase the interval to 2 years. Mammogram is again a radiation. So young age women who are in their 20s, 25 years should not be getting a mammogram. Then what are the other tests? So we also do a biopsy. Small biopsy, if there's any doubt, a small core biopsy is to be done. If there is a doubt in the mammogram, that confirms or differentiates the lump, what lump it is. Then once the diagnosis comes as breast cancer, what are the treatment options? So once it is a breast cancer, then the doctor stages the disease, which stage it is. And based on the stage, the treatment option is given. It can be a surgery or a surgery with a chemotherapy. Chemotherapy is giving you some more medicines or a radiation. Or can be a combination of all the three. So nowadays, because of improved survival chances, the surgery or radiotherapy and chemotherapy can be offered based on the stage. So better thing, the prevention part, better part is pick the disease when it is very early. So you have to screen the breast, do the screening test every time and check for the uh, early breast cancers. So after the breast cancers, let's talk about other cancers in the women. So before we talk about it, let's look at this picture. So can you all see this picture? Yeah. So this is where the uterus and ovaries are there. And this is how the uterus will be in between the urine bladder and the motion passage. Okay. So we'll now talk about ovarian cancer, uterine cancer, and cervical cancer. So cervix is a part below the uterus. So cervical cancers are more common cancers in women after the breast cancers. So who can get a cervical cancer? Cervical cancer, we think only the poor women who are not healthy or not so clean, very unhappy, one shabby conditions, who live in very poor conditions, they get the cervical cancer. But that's a myth. So any women of any socioeconomic status who is sexually active can get cervical cancer. So how do we get the cervical cancer? Cervical cancer is because of a virus called as HPV. So you all must have heard of this HPV virus. HPV virus is a virus like any other virus. It enters our body through a contact, through sexual contact, and it enters our body. So HPV virus can be a cancer-forming one or a non-cancerous one. So if it's a non-cancerous one, HPV can cause warts. So most of you must have seen the skin warts either on the hands, leg, face, anywhere warts can form. So the non-cancerous HPV cause warts. The cancerous HPV can cause cancers in the cervix, vagina, and vulva. So HPV virus, when it enters a body after a sexual intercourse from man to girl or girl to boy, it stays in our body. Because of our body's immunity, the virus is thrown away from the body after some years of fighting between the body and the virus. So early age girls, when they start their sexual activity, everyone are infected with HPV. But not everyone will get the cancer because the body's immunity will strive and push the virus out of the body. But for some whose immunity is weak and chronic smoking, lot of smoking, lot of alcohol, any HIV, multiple sexual partners, polygamy, all these increase the risk of cervical cancer. So all these make our body very weak. So we cannot fight this HPV virus, and HPV virus stays back in the body, and slowly it converts from infection to new precancerous stages to cancer. So cervical cancer is a very we know everything about cervical cancer, its etiology, how a woman gets cervical cancer, but still we see so many cases of cervical cancer. So what are the risk factors? Who all can get this disease? So who start their sexual activity at a very early age. So still in many parts of our country, girls are married off at a very early age, even though we got a legislation that marriage age should be 21. There are still many places where girls are married even before menarche. So the sexual intercourse starts very early in those sect of people. They are at a very high risk of getting cervical cancer, and multiple sexual partners or in repeated infections. So any all these things increase, and alcohol and smoking. Smoking is a very high risk factor for getting cervical cancer. So how do we know that we might be having a cervical cancer? So cervical cancer, it can just be without any symptoms. Suddenly, they can come with the stage 4 or stage high grade cervical cancers. But sometimes the women can have some discharge, abnormal discharge, and bleeding after coitus. Postcoital bleeding is a very common symptom of cervical cancer. Irregular bleeding, smelly discharge. So these can be the symptoms of cervical. So what should you do when you see anyone or someone tells you that these have these symptoms? You should direct them to a doctor, and a doctor does examine from her cervix and might do a pap smear or a cervical biopsy. So the What tests can be done for the cervical cancer? So these are the we can do a pap smear and a cervical biopsy. Can we prevent this cervical cancer? So prevention is definitely yes. You all must have heard of vaccination. So vaccination is a primary prevention. So we prevent the girl from getting infected with HPV. So there is a vaccine, HPV vaccine. We all must have heard of this. There's been a lot of social media programs and things about the HPV vaccinations. And so HPV vaccine should be given to young girls, especially from 9 to 11 years. If we have missed out at that age, at least any age, till 35, 40 years, who are did not start their sexual activity, they can still take the HPV vaccine. There are 3 doses of the vaccine: 0, second month, and 6th month. So the vaccine has been proved to be very effective in preventing the cervical cancer. So what about another preventive method? That is a pap smear. Pap smear screening is a very important screening method for cervical cancer. So there are many countries in the world where there is a national program. That means the government runs these programs, and every whenever the schedule is there, you are being sent a letter to your house to come for the screen. In our country, it's a voluntary screening. So you should go to the doctor every 3 years to get a pap smear done. So what does a pap smear do? Pap smear picks up any early stages of cervical cancer. So any early stages, like any precancerous stages, or not even precancerous, even very early stages, the disease is picked up, and we can do a small treatment options. So that doesn't mean that whenever the pap smear, we should do a big surgery. So there are small treatment options like cryotherapy or a cone, where we just localize the lesion there and ablate that lesion. So small treatments can be done for if it is picked up at an early stage. But what if, in spite of all these, a cancer is detected? Cervical cancer, we can be treated. If it is in a very early stage, stage 1 or 2A, then a surgery is an option. There is a surgery called hysterectomy, or extended hysterectomy, where which can treat the cervical cancer. Or if it has gone beyond the stage 2 and beyond, radiotherapy is a treatment of choice for cervical cancer. So, how can we prevent this? Definitely, yes. A good lifestyle, staying away from smoking, maintain using a contraception, especially condoms, and unigamous relationships, avoiding the preventing sexually transmitted infections. These can help us, and taking a vaccine definitely help us from staying away from cervical cancer. Now let's talk about uterine cancer. So we all know the uterus. Uterus is a place where the baby grows, and that is also a next common cancer in women after breast cervical cancers. So who can get uterine cancers? So even these has uterine cancer also, there are some risk factors, like especially those women who are very obese, obesity, or those who have hypertension and diabetes. So this is a three common things together. We call this a triad: hypertension, diabetes, obesity. So a woman who is in her after 40s, 45 years, and who have all these three things, they are at a high risk of getting uterine cancers. And women who has started her periods very early, who is having a menopause very late, who's having who has many menstrual cycles, heavy flow. These are the risk factors for uterine cancers. So how do we know that do we have this any of these uterine problems? So there is no definite test like pap smear to know about uterine cancers. We should be screening every women with an ultrasound, especially those who have these symptoms. So what are the symptoms of uterine cancers? So there can be heavy bleeding, uncontrollable bleeding, or irregular bleeding, or very frequent. So every 10 days they start bleeding, especially in that perimenopausal age group. Then we have to look for the uterine cancer. So some women might come to us after the periods have stopped. So 3 years, 4 years after the periods have stopped, again they start bleeding. So then we can even that is a common cause for uterine cancers. So what test can we do to check for this uterine cancer? There is no, we have to do an ultrasound. Ultrasound will tell us about the thickness in the uterus, the endometrial thickness. So based on that, a biopsy is done, either a pipal biopsy, a small outpatient biopsy, or a proper biopsy under anesthesia is done to check for uh, biopsy to check for uterine cancers. If it comes out as uterine cancers, then it is staged. Staging of the disease is done, and based on the stage, the surgery is to be planned. So usually, it is uterine cancers are surgically we can treat these cancers, but if it is beyond stage 2A, then a radiotherapy is also used. So, so the uterine cancers is actually a very good curable disease, better than a cervical cancer. But the prevention, how do you stop it from coming? A healthy lifestyle, preventing obesity, and proper screening, getting your ultrasounds done, especially when there are symptoms of heavy menstrual periods, will help us to detect any early stages of uterine cancer. And last, let's talk about ovarian cancers. Many of you must have heard of this ovarian cancers. Ovary is an organ which releases the eggs. So they are very, and also releases hormones. They are very important for a female. But a cancer in ovary can be a fatal thing as well. So, who can get ovarian cancers? What are the risk factors? See, any age group can get ovarian cancers, including girls who have not started their periods. From small girls to those who have stopped post menopause, any age girls, women, older women can get ovarian cancer. So there are different types of ovarian cancers, like germ cells. So they are from birth, germ cell tumors or sex cord stromal tumors. That means they secrete hormones, secretory estrogen, progesterone hormones, or epithelial cell tumors. So it can be proper ovarian cancers. So ovarian cancers are more common. And how do we know? We know that we have the ovarian cancers. They are very silent cancers. Many a times, most women come when it is very high stage. Sometimes there can be a swelling of the stomach. There can be loss of appetite, weight loss. So these can be the initial symptoms of an ovarian cancer. So what can we do if we suspect that? We have to get an ultrasound done as well as a higher test like a CT scan or an MRI to detect if there are any further how the cyst is, what happened to the ovarian cyst, and any other places where the cancer might be. So based on that, a staging is done and a surgery is planned. The surgical options are there for an ovarian cancer and followed by surgery or before the surgery, a chemotherapy option. So ovarian cancer is treated by both chemotherapy and radiotherapy. Sorry, and surgery. So these are the options. The survival chances are good if it is detected at an early stage, and then a follow-up is advised every 3 months for two years. And how do we prevent the ovarian cancers? So prevention, yes, we have to maintain a healthy lifestyle, pregnancies, uh, and screening is an important step in detecting an early stage disease. So, of all the cancers, the basic thing is we have to get ourselves screened. So, the screening tests are there for all the cancers nowadays. So, a health check, especially after 40 years. So, for every woman, be it a pap smear, be it a mammogram, be it a ultrasound for endometrium and ovaries, should be done. And also, screening for other cancers like colorectal cancers, lung cancers should also be advised. So the screening is a better way of picking up an early stage disease. So I think I'll conclude by now. And anyone has any questions, we can share those questions. Thank you. Thank you very much.